AJR's Ask the Experts continues now with the folks from HealthWorks Rehab and Fitness. Dr. Jacob Conjeski is from Mountain State Orthopedics, and Mark Hose is from HealthWorks Rehab and Fitness. Our topic today, physical therapy and joint replacements. Opening segment, we talked about the prevalence of joint replacement surgery. Over 1 million procedures are done in the United States each and every year to the knee and the hip. Average age, 65 years old. We talked about trying to hold off to have the procedure done by using various medicine or physical therapy. Let's jump ahead here now to the point of, okay, that did what it could do, but that's not enough, and now we're going to replace the joint. One of the terms that I hadn't heard about until recently is prehab. You always hear about rehab, prehab. What is prehab when it comes to someone getting ready for joint replacement, Mark?
So we know that the ultimate goal is they're getting their knee or hip replaced. We know that all at the beginning. So the goal is to try to get them as strong as we can, to get the motion, as much motion as we can in that knee or hip, so that when they do go in for surgery, they are strong and have the most mobility, so they can have a better successful surgery. Because most times, again, they're coming in prior to this having a lot of pain, a lot of restrictions. And if they decide to have the surgery right away, they may not have more struggle on the post-surgical aspects of getting the motion and getting their function back. So we're just kind of giving them a little kickstart, trying to get them started with stuff, give them some exercises, and then usually after surgery too, they're going to be seeing some of these same exercises, so they're going to already be kind of ahead of the game.
Mm-hmm. Yeah, absolutely. Normally that lasts for how long before the procedure is done?
Usually about 4 to 6 weeks prior, just to kind of get them going and get them moving a little bit. We know they're going to have some pain, so we still use the modalities and other stuff to help control the pain, to keep them in check. But we know that we want to get them as strong as we can. That it's also usually the process when they're trying to get all their testing and stuff done with their family doctor and stuff, so they can be ready for surgery and they can go right into it.
Jacob, you said earlier that it used to be a 10-day procedure. Now it can be a very simple procedure as far as stay. Let's talk about that person that comes in for, let's just say, hey, let's just do the knee to begin with. What's that like for someone that goes through that? From a surgical standpoint, what exactly are you doing? When someone says joint replacement, what are you doing?
I guess in layman's terms, yes, we are replacing the joint, and they're metal implants, and they also have a very hard piece of plastic that goes in between the metal components. I think the biggest advancement in technology has been that piece of plastic, because traditionally, when you put a piece of plastic between two pieces of metal, the plastic always wears out first. And what they found was it was really the sterilization process that was weakening the plastic. So once they got that figured out, the plastic is lasting a lot longer. And that in turn is leading to these patients having their joints in a lot longer. The procedure, we try to do these as minimally invasive as we can. At the same time, it is a total joint replacement, so we have to have a wound big enough that we can see what we're doing and get the implants in a good position.
Procedure lasts for normally how long?
It's usually right around an hour. I'd say about an hour for a total knee. For a total hip replacement, maybe an hour and 15 minutes or an hour and a half.
That is not a long time, is it? I mean, that's pretty impressive.
Yeah. We're doing more and more of these. We've got a staff that's very familiar with this procedure. So the staff gets a lot of practice. So it really helps.
So that person then can leave when? Conceivably that day?
Mainly on their health status. So a younger, healthier patient, or even an older patient that doesn't take a lot of medicines at home, we think they're pretty low risk. And if they want to, we let them go home the same day. So we'll do a same-day joint replacement. Patients who stay, I usually get them out the day after surgery. It's usually one night in the hospital if they stay.
Okay, so what shape are they in once they do get home as far as mobility goes? Once that's done, where are they at?
We get them up, get them walking day of surgery. So there's no weight-bearing restrictions. Everyone's on a walker the day of surgery, and we do that mainly for safety. We don't want them falling and injuring themselves, but it's weight-bearing is tolerated from the second they wake up. So we get the therapy going relatively quickly after surgery to get them moving.
Okay, so then how long, Mark, normally after someone has had a procedure, are they seeing you at HealthWorks?
So depending on when they had surgery and their health status also, some patients go to home health, because of just transportation or other issues. Other times we will actually see the patients a couple days after surgery. They're still using the walker, the dressing, the dressing's still on the incision. And so we're starting them, pretty fresh right after surgery. And we'll, that first day of, therapy a lot of times is assessment of, how things went, changing their dressing to make sure things look good underneath, and start getting moving. So they're like Dr. Conjeski said, there is no restrictions. Their weight bearing is tolerated. We're trying to get them moving. We're trying to get their pain under control. I think the benefit here with technology is the pain control, because they're having less pain. They're able to control their pain a little easier and faster. So we're not seeing them that first day at a 10 out of 10 pain level.
Mm-hmm. And normally, from the time I see you, Dr. Conjeski, through physical therapy, what's the evolution of getting back to life as normal?
I tell everyone, give yourself a good 3 months to get over it. It's not 3 months of agony, but 3 months before you're really starting to forget, hey, I had my hip replaced or my knee replaced.
Yeah. It's amazing when you do talk to people that had it done, they say, oh my gosh, changed everything. Because some obviously were at a point where pain and inability to do things that they couldn't, wanted to do. And it's a changer. It's an absolute game changer. And you do that each and every day. So put a smiley face, man. You're helping people out each and every day, all you guys.
About.
Okay, we'll talk about more when we come up. Changes in the procedure in regard to what's the future hold for this kind of stuff. We've been focusing on knee. What about hips and things like that? Stay with us. More coming up. Ask the Experts is being brought to us by HealthWorks Rehab and Fitness. We're joined in studio by Dr. Jacob Conjeski and Mark Hose. More coming up here on WAJR.